Hi dentist, it's P square. Let's learn dental material topic, irreversible hydrocolloid, that is alginate. It is very interesting and very important as it is most used impression material in the clinics, and a 5-mark short note comes on this as write short note on irreversible hydrocolloid. Alginate, also called as irreversible hydrocolloid, it is naturally occurring colloidal polysaccharide obtained from brown seaweed. Nowadays it is more popular than agar for dental impression and it is simple to use. It is of two types, type 1 fast setting, type 2 normal setting. It is supplied as in bulk packing like tins, bins or sachets, as pre-weighted packet for individual impression, as two-phase systems. Dust-free alginate, it is very important and it is explained in biological properties. Chromatic alginate, in this material changes color on setting. Application, it is used for impression making in case of undercuts. Undercuts are depression or lingual or labial side of the ridge in mouth with excessive flow of saliva, for partial dentures with clasps, for making preliminary impression for complete denture, for impression to make study models or working casts, for duplicating models. Composition, 15% sodium or potassium or triethanolamine alginate. It dissolves in water and react with calcium ions. 16% calcium sulfate as reactor. Zinc oxide 4% act as filler. Potassium titanium fluoride 3% gypsum hardener. Diatomaceous earth 60% act as filler. Sodium phosphate 2% retarder. Its role is explained in setting reaction. Coloring and flavoring agent in traces, example wintergreen, orange, etc. सेटिंग रिएक्शन, एल्जिनेट वाटर के साथ मिक्स होकर सोल बनाता है जो कि बाद में जेल में कन्वर्ट हो जाता है बाय केमिकल रिएक्शन। होता क्या है कि सोडियम एल्जिनेट रिएक्ट करता है कैल्शियम सल्फेट के साथ टू फॉर्म फाइनल जेल दैट इज इनसॉल्युबल कैल्शियम एल्जिनेट। ये रिएक्शन बहुत फास्ट होती है जिस कारण सफिशिएंट वर्किंग टाइम नहीं मिल पाता। तो क्या किया है कि मैन्युफैक्चरर्स ने रिटार्डर ऐड किया है जो कि है सोडियम फॉस्फेट, जिस कारण कैल्शियम सल्फेट पहले प्रेफर करता है रिटार्डर के साथ रिएक्ट करने के लिए। जब रिटार्डर ख़त्म हो जाता है तो कैल्शियम सल्फेट रिएक्ट करता है एल्जिनेट से, सोडियम एल्जिनेट से, जिस कारण रिएक्शन डिले होती है और हमें सफिशिएंट वर्किंग टाइम मिलता है। जेल स्ट्रक्चर, फाइनल जेल इज क्रॉस लिंक स्ट्रक्चर which consists of brush heap of calcium alginate fibril network enclosing unreacted sodium alginate solution, excess water, filler particles and reaction byproducts. Calcium is responsible for cross-linking. Properties, alginate have pleasant taste and smell. It comes in different flavors including strawberry, orange, mint, etc. Flexibility is about 14% at stress of 1000 gram per square centimeter, which is lower than agar. It is highly elastic and the elastic recovery is about 98.2%. Reproduction of tissue detail is lower as compared to agar. Strength, compressive strength ranges from 0.5 to 0.9 megapascal. Tear strength is important property of alginate. It ranges from 0.4 to 0.7 kilonewton per meter. It has poor dimensional stability due to evaporation, syneresis, which is loss of water, and imbibition, which means absorption of water. Therefore, cast should be poured immediately. When placed in contact with water, alginate absorb water and swell. It is called as imbibition, and if left in dry atmosphere it lose water, that is called as syneresis. A short note comes on imbibition and syneresis. Biological properties, silica particles present in dust can cause health hazard, therefore avoid breathing the dust. Dustless alginate contain glycol which coat the silica particles and prevent health hazards. Adhesion. Alginate does not adhere well to the tray. Manipulation. Mixing equipment required are a clean flexible plastic bowl, a stiff metal spatula. First we take water and then sprinkle powder on it. Take the material in proper water powder ratio, that is usually 1:2. मिक्सिंग स्टार्ट करते हैं स्टरिंग मोशन के साथ ताकि पाउडर अच्छे से वेट हो जाए. फिर हम रैपिड स्पैचुलेशन करते हैं स्वाइपिंग एंड स्ट्रोपिंग अगेंस्ट द साइड ऑफ द बाउल, और वी कैन यूज विगरस फिगर 8 मोशन. मिक्सिंग टाइम for fast setting alginate it is 45 seconds and for normal setting alginate it is 60 seconds. Over mixing result in reduction of final strength and reduction in working time, and in case of under mixing there is lack of homogeneity and reduction in strength, as well as the mix is grainy in consistency. Working time for fast set is 1 minute and 15 seconds. For normal set it is 2 minutes. Setting or gelation time for type 1 ranges between 1.5 to 2 minutes, and for type 2 it ranges from 3 to 4.5 minutes. Tray selection. As alginate has poor adhesion, tray selection is very important. It can be obtained by mechanical locking feature of the tray like perforated tray, or by applying adhesive, or we can use combination of both the above. Note, the tray should cover entire impression area and provide a space of at least 3 mm on all the sides. Loading the tray. The mixed alginate is pressed and swiped into perforated lock tray. The surface of alginate in the tray may be smoothened out by using a moist finger. A small amount of material is taken on an index finger and applied on occlusal surface of the teeth and rugae area. This holds to reduce air voids and improve the accuracy. Alginate impression should be left in the mouth for at least 2 to 3 minutes after initial setting. Test for setting. The material loses its tackiness when set. It should rebound fully when prodded with a blunt instrument. In case of chromatic alginate, it changes color after setting. Disinfection of impression is very important and is concerned because of viral diseases such as hepatitis B, AIDS, herpes simplex. Recommended disinfectants are phenol, iodophor, bleach and 2% glutaraldehyde. Advantages. It is easy to mix and manipulate. Minimum equipment is required. Accuracy if handled properly. It have low cost and is hygienic. Flexibility of the set impression. Comfortable to the patient. Give good surface detail even in presence of saliva. Disadvantages. It cannot be electroplated to make dye. It cannot be corrected as it is irreversible. It cannot be stored for long time as it have poor dimensional stability. It have poor tear strength and distortion may occur. Not recommended where high degree of accuracy is required. For example, cast partial denture, crowns, fixed partial dentures, etc. Thanks. Make sure to share the knowledge with your friends. Keep supporting.